In a 2002 Medical Anthropology quarterly publication by Joseph Pizzorno, it's titled CAM Differentiated. As a natural medicine practitioner, educator, and author, I found the perspective of an anthropologist endeavoring to explain the phenomenon of which I am a part quite interesting. Dr. Mikosi insightfully provides a diverse range of criteria contrasting complementary and alternative medicine with conventional medicine. He is perceptive in recognizing vitalism, holism, cultural continuity, bioenergy, and ecological balance as fundamental to the CAM movement. I especially like his ecology of health characterization. However, his discussion is impaired by lack of recognition that the health practices and practitioners labeled CAM are not homogeneous, but in fact are quite diverse. The same fact significantly complicated the deliberations of the White House Commission on Complementary and Alternative Medicine Policy. The need for definition and differentiation. Before answering the question, what differentiates CAM from conventional, we need to address what is CAM. Unfortunately, this term, though commonly used and becoming codified in federal law, misdirects the discussion. Complementary and alternative defines us by what we are not, rather than by what we are. Even worse, CAM indiscriminately lumps together essentially any practice or practitioner that is not conventional, regardless of philosophy, training, research, safety, efficacy, or ethics. We do not define ourselves as CAM practitioners. We call ourselves naturopathic physicians, chiropractic doctors, acupuncturists, herbalists, and so on. Accurate definition requires differentiation. I recommend 6 categories. Professional practitioners with a cohesive healing philosophy, defined practice standards, accredited education, state licensure or registration, documented safety, and at least some research substantiation. Examples include naturopathic physicians, chiropractic doctors, and acupuncturists, holistic medical doctors with conventional training and varying degrees of competency in CAM modalities. Some may be credentialed in one of the recognized professions. Traditional healers who practice within a community that provides centuries-old traditions and oversight. Examples include Native American healers and curanderos. Lay and inconsistently trained practitioners in emerging professions who are working to establish standards. Examples include lay homeopaths and herbalists. Self-proclaimed or minimally educated practitioners who practice without apparent standards or oversight, often advocating theories with no apparent scientific rationale. Medical mavericks who are conventionally trained but utilize therapies and practices that are highly controversial or are excluded from conventional standards of care. The first 4 categories of practitioners are fairly well categorized by Dr. Mikosi, whereas inclusion of the latter 2 categories within CAM highlights a serious problem. The professional practitioners provide the majority of these services to the public. With accredited institutions, textbooks, and practice standards, they are the most easily understood. Key to the professional practitioners is a cohesive philosophy that fundamentally drives their worldview. Diagnoses and therapies. For most, the healthcare they practice involves more than different philosophies and therapies. It is a way of living and being in the world. Although certainly not identical in theories or practice, all share several characteristics. Central to these practices is a strong belief in the body's ability to heal itself, if given a chance. This is variously defined as vitalism, vis medicatrix naturae, bioenergy, chi, and so on, and more than any other factor, characterizes these systems of healing and provides the rationale for their approaches. These may be illustrated as treating the whole person, mind, body, and spirit, not just isolated physiological systems. Patient-centered rather than practitioner-centered, success defined more by patient satisfaction than by the results of a laboratory test. using therapies, preferably found in nature, that support the body's own healing processes rather than therapies that take over body processes. For instance, immune support rather than antibiotics. Health and function restoration rather than waiting for end-stage pathology. Reversing the underlying causes of ill health rather than just symptom relief. Although these philosophies and therapies have not been provided with the depth of research conventional medicine has enjoyed, a considerable body of published research supports many of these approaches. Some professional practitioners, such as naturopathic physicians and broad-scope chiropractors, rely heavily on the biomedical model for implementation of their vitalistic philosophy. Holistic, conventional medical practitioners share many of the characteristics of the professional natural health practitioners. However, without credentialing and defined educational and practice standards, they are more difficult to characterize. Some embrace the vitalistic philosophy, whereas others simply add some natural therapies to their therapeutic armamentarium. The traditional healers are probably the closest to representing a purely vitalistic tradition fully integrated into a culture. Their interventions are deeply rooted in spiritualism and culture, aided by astute application of physiologically active herbal medicines. Those in the emerging professions share some of the characteristics of the established natural medicine professionals, but have not yet evolved or agreed to evolve to the same level of sophistication. These groups of practitioners are deeply divided on the issues of standards and professionalization. They are poised to advance to professional status or fade deeper into the fifth category, the self-proclaimed. The final two categories are problematic to define and characterize. Although many self-proclaimed practitioners may be well-meaning, their lack of a cohesive philosophy, formal education, standards, and oversight create, in my opinion, a substantial risk to the public health. This danger ranges from self-proclaimed naturopaths, like the one who last year took a diabetic child off of insulin and described her rapidly declining health as a detoxification reaction, to unscrupulous practitioners aggressively selling ineffective products to an unsophisticated public. The medical mavericks are the most difficult to address. They are conventionally trained, but apparently become enthralled by interventions that the conventional system either rejected or was unwilling to evaluate. Depending on one's viewpoint, they may be characterized as incredibly dedicated, following their beliefs regardless of the personal consequences, or, unfortunately, deluded. Final thoughts. Consumers are searching for more comprehensive approaches to their healthcare, wanting to integrate mind, body, spirit care. They are weary of the growing burden of illness suffered in all age groups. The same searching is occurring among conventional practitioners. A growing number are burned out on their practices, seeing themselves as little more than salespeople for the pharmaceutical industry and locked into an ever more dehumanizing and constricted practice environment. Many are joining their natural medicine sisters. Most natural medicine practitioners are women, and accepting a decrease in income, yet reestablishing their joy in becoming the healers they originally intended to be.